Think again. All right, let's talk about smoking. For decades, the main event, the headliner on the Why Smoking is a Terrible Idea tour, has been cancer. And yes, of course that's true, it's catastrophically true. Linking smoking to cancer is like linking water to wetness or a politician to a suspiciously vague answer about their tax returns. But here's the thing, and this is important. Focusing only on cancer is like describing a shark as just a bunch of teeth. You're missing a whole lot of the terrifying, bitey picture. The tobacco industry has essentially sold you a horror movie, but they've only shown you the trailer for the final monster, completely ignoring the jump scares, the psychological torment, and the part where the family dog mysteriously disappears. The conversation has been so dominated by that one, admittedly very large C-word, that we've forgotten all the other ways this little paper tube of death wants to ruin your life. It's a multi-talented menace, a Swiss Army knife of corporeal destruction. It's not just aiming for one organ system, it's playing physiological whack-a-mole with your entire body, and it holds all the mallets. Let's start with the basics, your heart and lungs, the dynamic duo of keeping you, not dead. When you smoke, you're not just inhaling some gentle, fluffy vapor. You're mainlining a chemical cocktail that includes carbon monoxide. Yes, that's the same stuff that comes out of a car's exhaust pipe. You are, in a very real sense, turning your own body into a poorly ventilated garage. This glorious gas elbows oxygen out of the way in your red blood cells, which means your heart has to work much, much harder to pump enough oxygen-rich blood to the rest of your body. It's like forcing your heart to run a marathon every single day, but on a diet of pure tar and disappointment. And what about your blood vessels? Oh, you'll love this. Nicotine, the addictive star of the show, acts like a bouncer at a club. Except instead of throwing out unruly patrons, it just tightens and constricts your arteries. This makes it harder for blood to flow, driving up your blood pressure. It's like trying to force an entire river through a garden hose. Over time, this constant pressure damages the artery walls. The body then tries to patch up these damaged spots with fatty deposits or plaque. This process, called atherosclerosis, is basically your body creating little speed bumps of gunk inside your arteries. Now, for your lungs. We all know smoking is bad for them, but the how is grimly fascinating. Your lungs are lined with tiny, hair-like structures called cilia. Their job is to sweep out mucus, dirt, and other gunk you breathe in. They are the microscopic janitors of your respiratory tract. Smoking first paralyzes and then completely obliterates these little guys. Without them, all that tar and toxic mucus just sits there, festering in your lungs. This is what causes that signature smoker's cough. It's your body's desperate manual attempt to do the job that millions of dead cilia can no longer perform. It's not a cough, it's a cry for help from a drowning organ. Okay, let's move upstairs to the command center, your brain. You might think smoking helps you focus or relax. That's a clever trick, and it's one of nicotine's greatest cons. Nicotine is a stimulant that gives you a quick hit of dopamine, the feel-good chemical. But your brain, being the smart, adaptable organ it is, quickly gets used to this artificial boost. It starts producing less of its own dopamine and reduces the number of receptors. This means you need more and more nicotine just to feel normal. That's not relaxation, that's the definition of addiction. You're not smoking to feel good, you're smoking to stop feeling bad. It's a chemical hostage situation where you are both the victim and the one paying the ransom. But the damage goes much deeper than just the cycle of addiction. Remember those constricted, gunk-filled arteries we talked about? Well, your brain needs a constant, healthy supply of oxygen-rich blood to function. When the blood vessels leading to and inside your brain become narrowed and damaged, you are dramatically increasing your risk of a stroke. A stroke is essentially a brain attack. It happens when a blood clot blocks an artery or a blood vessel bursts, starving a part of your brain of oxygen. The consequences can be devastating, ranging from memory loss and speech problems to permanent disability or death. Smoking basically puts your brain on the fast track to a catastrophic plumbing failure. And the fun doesn't stop there. There is growing evidence linking long-term smoking to an increased risk of dementia and Alzheimer's disease. Yes, really. Furthermore, smoking can mess with your mental health in other ways. While many people smoke to cope with anxiety and stress, studies show that smokers actually have higher rates of anxiety and depression. Now for the really weird stuff, these are the deep cuts on the Smoking Will Ruin You album that never get any radio play. Did you know, for instance, that smoking can actually make you go blind? Yes, blind. Smoking dramatically increases your risk for age-related macular degeneration, or AMD, which is the leading cause of severe vision loss in people over 50. It also increases your risk of cataracts. Let's talk about your immune system for a second. You know, the complex network of cells and proteins that defends your body against infection and disease. Smoking throws a wrench into that entire system. It increases inflammation throughout your body while also hampering the ability of your immune cells to fight off invaders. And then there's the smoke you don't even inhale yourself, secondhand smoke. This isn't just some annoying, smelly cloud. It's a Class A carcinogen, the same classification as asbestos and arsenic. It contains all the same toxic chemicals that the smoker inhales. When you smoke around other people, your friends, your family, your children, you are forcing them to take on those risks too. For children, it's particularly dangerous, leading to a higher risk of sudden infant death syndrome or SIDS, asthma attacks, ear infections, and respiratory infections. And if all that isn't enough, smoking also wrecks your bones, making them weaker and more likely to fracture. It damages your skin, causing premature wrinkles. It stains your teeth and gives you gum disease. It can lead to hearing loss. It can cause infertility in both men and women. The list is honestly absurdly long. It's almost impressive in a morbid way how one single habit can find so many different avenues to systematically dismantle a human being. So, we've taken a scenic tour through the smoldering ruins of a smoker's body. We've seen that focusing only on cancer is like saying the iceberg's only threat to the Titanic was its pointy tip. The truth is, smoking is a full-body assault. It's a relentless campaign against your heart, your lungs, your brain, your bones, your eyes, and even the people standing next to you. It's not a habit. It's a subscription service for a lifetime of escalating health problems with a very high final cancellation fee. It's a con game where the house always wins, and the prize is a collection of ailments you wouldn't wish on your worst enemy. It's the kind of information that should make you look at a cigarette not as a stress reliever, but as a tiny, expensive, and incredibly effective wrecking ball. The good news, and there is some, is that your body has an amazing capacity to heal. The moment you stop smoking, your body starts to repair itself. Within minutes, your heart rate and blood pressure drop. Within a few months, your lung function begins to improve. Over the years, your risk for heart disease, stroke, and yes, even cancer falls dramatically. It's not an easy journey because nicotine addiction is a powerful, cunning beast. But it is a possible journey, and it's one that millions of people have successfully made. The best time to quit smoking was 20 years ago. The second best time is right now. So the next time you see someone light up, or think about doing it yourself, remember the whole picture. Don't just think about the final act monster of cancer. Think about the slow, grinding destruction of COPD. Think about the sudden, catastrophic failure of a stroke. Think about the fog of dementia, the blindness of AMD, and the wheezing cough of a child exposed to secondhand smoke. This is not about judgment. It is about information. Your health is your most valuable asset. Don't set it on fire, one puff at a time. Learn the facts, understand the full scope of the risk, and take care of yourselves. Because you deserve a long, healthy, and breathtaking